Our next presenter is Dr. Marla Nedelcu. She's an assistant professor of religion and spiritual care at Advent Health University. Previously, she's taught at Southern Adventist University, pastored for the Georgia Cumberland Conference, and holds a PhD in theology from Andrews University. Dr. Nedelcu.
Good morning. Well, the topic of my paper became quite large, and so I don't know if you've seen it online, but this presentation is just taking a few snippets from it and distilling it for you here. So there's going to be two sections in what I talk about. First of all, the need for training in compassion and resilience for healthcare students. And then the second part of it will be case studies from classes that I teach in grieving and loss, different issues that we confront in that class and how we've been able to resolve them. And so starting out, I have been working with healthcare students as a professor for about 6 years, first at Southern and then at Advent Health University. And I started out by developing graduate religion courses that were required of nursing students. And God and Human Suffering, Jesus as Healer. And I had never taught specifically for healthcare workers before. And so I started asking as many people as possible within nursing, even talked to some CNOs, but from every level of nurses, what kinds of things would you value in religion courses? And every single one of them said, you know, it's great to learn what we usually learn in these religion courses, but what we really need is how to deal with the suffering that we face every day, every minute in our career. We're confronted by this suffering and we don't have any tools to know how to handle it. And so I started looking into that more. And there was one saying that kept on being repeated that shocked me because I had never heard it before. And it was that these people I would speak with would say that nurses eat their young. I don't know if any of you heard that. I hadn't heard it. What that means basically is that when new nurses come into the profession, they get bullied by the older nurses. And that was seemed like such a paradox for me because from what I had been studying, people who choose to go into healthcare professions, especially nursing, their personality is more predisposed to empathy, agreeableness, openness, conscientiousness, different traits that you wouldn't think would correlate with bullying. And so I wondered, how could people who are maybe more naturally empathetic than the average population, how could they become the ones who would bully? And we don't have any studies that say like what percentage of nurses are bullies, but we do have studies the other way around that say that about 3/4 of nurses within their first 6 months have reported bullying from experienced nurses. And so that was a question that really kept on going around in my mind. How can we resolve this paradox? And what I realized is that when nurses, other healthcare professionals too, but I focused on nurses, when they enter their career, there are obviously so many factors that they were not prepared for. Their schedule, the trauma of the cases they're dealing with, so many different factors, that's a whole other paper, that in order to cope, they start to depersonalize their experience. And so instead of seeing their patients, they might have gone into this with a spirit of just really wanting to serve and really wanting to help and minister. In order to cope with all of the trauma that they are experiencing from their patients' suffering, but also institutional trauma that comes upon them, they start to see their patients as diagnoses or group members and not as people. But what happens when you depersonalize like that is that you become cynical about what you're doing, which is the opposite of empathy. And as you continue in that train, you have this experience of not treating your colleagues also as humans, but also depersonalizing them. And eventually that leads to burnout. It's funny because you would think that if you feel an emotional connection with a patient, that could exhaust you emotionally. But what studies actually show is that when you are able to maintain that emotional connection with your patients, it actually brings purpose and meaning in your life, and it protects you from burnout. And so, nurses, however, are not taught how to cope with these, I'll look here at a list of different things that are the greatest offenders as far as causing trauma in healthcare professionals. Heavy workload, understaffing, high metrics and targets, time constraints, long hours, not having control over your own schedule, cognitive load, high stress, patient complexity, repeated exposure to suffering, vicarious traumatization, emotional exhaustion, workplace environment, including bullying and workplace violence, which has really increased, especially after COVID, physical violence against nurses, and organizational pressures. They're all systemic factors that contribute to cynicism and undermine a capacity for empathy. And so we train nurses in how to be skilled in the technical aspects of their job, but in order for them to continue on successfully, we really need to train them also in how to handle the emotional load that will be confronting them. Especially now, studies show, actually there was a 2025 study by the NIH that showed that 30 to 70% of nurses, of new nurses currently, leave the profession within the first year. 30 to 70% of nurses leave their profession within the first year. And I think of like the university where I'm at, Advent Health, where we're really trying to provide as many nurses as possible for the Advent Health system. And yet, if we graduate them, and then 30 to 70% of them leave within the first year, what good is that, right? And so it's really important that we look at these factors of how to keep nurses satisfied and having purpose in their careers. And so for me, that is training them in compassion, but that's not enough. It's also training them in resilience, because they might even have naturally compassion because they've chosen to go into nursing, but then how are they able to persist through these difficult experiences that they have? And that's through teaching resilience. There are many different ways of doing those things, teaching compassion and resilience. I cannot go into them today, but I will say that studies definitely show that if you train healthcare workers in compassion and resilience, their physical health and their mental health is improved drastically. The patient's satisfaction and healing times are improved. So you can even look at studies that show, like, if a patient perceives that they have been treated by a healthcare professional who showed them compassion, the healing time of their wounds will be lessened. I mean, very measurable things that are really quite incredible. And with higher patient satisfaction comes greater profits for the healthcare institutions. So it's actually win-win all the way around. And even things like with doctors who report that they feel burned out, or they feel like they don't have, like they've depersonalized themselves from their patients, self-report that they make more medical mistakes. So I believe that it's actually our moral obligation, especially in Adventist universities, to equip healthcare workers for this aspect of their roles too, equip them for how to handle secondary traumatization, which they will experience, the moral distress, which they will experience, compassion fatigue and burnout. Now, the greatest factor in nurses, especially, leaving their careers in the first year, studies have shown, is the fact that they are not able to make the transition from school to work, because specifically they have not been trained in these emotional aspects of how to handle the emotional difficulty of their jobs. But this is something we can do, and we can do it in our religion classes for our healthcare workers. So some of the classes that I'm teaching now have to do with grieving and loss. I teach on the undergraduate level and the graduate level in this. And for these classes, they're perfect classes to teach compassion and resilience. But I'm going to deal now with one big issue in this area of grieving and loss that blocks healthcare workers from being able to show compassion and resilience to their patients. And that is the area of unaddressed grief, unaddressed provider grief. And now I'm going to turn to read some more from my paper. It is not uncommon for patients' grief or families' loss to remind a healthcare worker of grief or loss in their own past. And if they have not addressed this loss, it can be a very difficult situation emotionally. It can cause healthcare workers to start depersonalizing their patient in order to cope, which leads to less empathy and compassion, and in time, less resilience and more burnout. An integrative study of relevant literature, nearly 97 documents, concluded that working closely with pain and the process of dying involves healthcare workers on a personal and human level before a professional one. If this suffering is not recognized and addressed, it can cause a series of difficulties that affect the health of the worker and the health care of the patient and their family. Tell me the time that I have this. Okay, perfect. And so you can think of this in your own life. In times when you feel more stressed or your heart is encumbered by some sort of trauma, it is more difficult, isn't it, for all of us to be able to really empathize with a friend who might come to us that's hurting, because we're kind of just blocked by our own pain. And so this is, on a larger level, what happens in healthcare. Studies show that unaddressed provider grief leads to depersonalization of patients, reduced quality of care, increased absenteeism and turnover, lowered morale, decreased productivity, and greater risk of long-term health problems among staff. Unaddressed grief in healthcare workers is also associated with sleep disturbance, reduced cognitive ability, impaired judgment, feelings of isolation, anger, and guilt, loss of self-worth, and sense of meaning in life. Elizabeth Kubler-Ross, who came up with the 5 stages of grief, herself wrote that working through the fears, pains, angers, hurts, and unfinished business from one's own past clears the way to work better with dying patients. Now, it's interesting because studies show that whether you talk to a therapist or whether you even write in a journal your own trauma, or if you talk to a friend about what's bothering you, like all of these things have an incredible impact in being able to reduce the load of the trauma in your life, strengthen your immune system, reduce physical and emotional distress, and lead to better health. This is because verbalizing emotional pain reduces amygdala activation, which moves one away from limbic reactivity by instead activating parts of the brain that deal with language and meaning. So you're taking that unspoken trauma and you're putting it into words, either oral or written, and you're coming up with a meaning for it, a purpose for it. There are various formal and informal ways of doing this. I loved her paper, and it reminded me of something that a project that's been piloted in Zimbabwe called the Friendship Bench. Have you heard of that? It's very interesting. So the government of Uganda didn't want to invest in mental health maybe in the way they should for a lot of the youth who are going through trauma, but they decided to train grandmothers in the community in certain ways of how to listen to people and how to sympathize and how to guide them in the direction of positivity when they're suffering from depression and anxiety. And so they just have these benches in public areas, but a little bit private, and anybody can come and sit and talk with the grandma about their problems, and they meet for a few sessions, and they've had incredible results from that, and it's being piloted in other parts of Africa as well, And so I think it's wonderful to go to a therapist, but even if that's not possible, like there's just studies show that even just being able to have one friend that you can talk to about your problems makes an incredible difference. Now, so in my class in grieving and loss, I also want to help the students address their own grief if they haven't done that before. Because if they haven't addressed their own grief, when they start working, they're going to have a patient that reminds them of somebody who's died in their past. If they've dealt with it, all those emotions are going to be activated then, and their body's going to try to deal with it then. It's going to make it very difficult for them, and it's going to make it harder for them to be compassionate caregivers because they're blocked by their own feelings. And so in my class, I have different opportunities for students to be able to express some of their griefs, the ones that they choose to, in written form, or by meeting with a therapist, or by meeting in a small group, or by meeting with a grief coach. Different ways I have of doing that. And so that can be a little tricky because you don't want to, you might wonder, is this going to re-traumatize the students? And yet it's also so important because they are going to be re-traumatized when they start working if they haven't dealt with this. And so in order to be able to navigate that, I turned to trauma-informed pedagogy and different methods that it gives of being able to handle sensitive topics like this in a way that will be as safe as possible for the students. And so the next part that I'm going to talk about is different methods that I've used in my classes, past, present, and some I want to use in the future, that come from trauma-informed pedagogy, of how I've been able to navigate these issues in my class in a way that is still supportive to my students. Trauma-informed pedagogy, I'll tell you what it is if you haven't heard of it. It's an educational approach designed to recognize and respond to the impact of trauma on students, fostering supportive learning. And you can kind of sum it up by 5 different areas: safety, predictability, voice and choice, flexibility, and connection. And so I have 14 points that I've implemented or want to implement in my class that go in these 5 categories. And I'll go through a few of them now. Okay, so under the topic of safety, how do we keep our students safe? This is something that's recommended in trauma-informed pedagogy. I haven't put this exact statement in my syllabus, but something like this. As an instructor, one of my responsibilities is to create a safe learning environment. I will try my best to be open about my expectations. That's really important, to have the predictability there. They're not surprised by anything. And to provide choice in my assignments as much as you can. Give them options so they can choose which one they feel most comfortable with. If you experience stress related to the coursework, please speak with me. If you are experiencing stress from things outside the class, so-and-so provides free and confidential counseling services. Another thing is to watch for signs that students may feel uncomfortable and reach out to them proactively in order to address their concerns and offer support, because before it gets more serious. Provide further resources for support. So I have a list of people who have worked with my class who provide free services. Some of the times it's paid. Brief coaches, counselors, people that are focusing on trauma. So if they want to get more help, they can go there. And then predictability, like clear rubrics that you follow, maintaining a consistent routine or schedule. These are things that help the students to feel more settled in the class and less anxious, so they can handle topics that might cause more anxiety. If there are assignments that I think might be more emotionally difficult, I have in my online class a couple weeks before something that says prepare. And it will say, this assignment is coming up, start thinking about it. If you need extra help, if you want to talk to me, let me know. So it's not something that's going to surprise them if they only look at an assignment the night before. Voice and choice, so providing an option of how they can submit assignments. I'll have like some things they can do in written form or audio or verbal recordings, or even talking to us directly in order to fulfill that assignment, if that makes it easier and less anxiety inducing for them. I will skip to one other one that I think is super important, and that's to be able to keep a low student to teacher ratio. And so the ideal is about 20-1 for if you're trying to teach things like this, like compassion and resilience. Because how am I going to be able to know and to sense if a student is struggling and needs extra support if I have so many students in my class? And so the way that my classes were set up when I first came to Advent Health is that the class size could become very large, but we would divide it into sections of 20 to 25, and I would be able to have adjuncts under me who I would choose as pastors or counselors or chaplains who I knew could work well with students in these areas. And then I would oversee the whole class and have a section, but then they would be tasked with forming personal relationships with these students in order to be able to help them in these areas and to reach the first line. So we'll just go to the conclusion. Ultimately, preparing students to navigate the emotional demands of healthcare is as critical, I believe, as teaching clinical skills if we consider the whole person well-being of both the healthcare providers and the patients. When compassion and resilience are nurtured together, healthcare workers are better able to provide thoughtful, high-quality care, sustain their own well-being, and thrive even in challenging healthcare environments. Investing in this dual training is an investment not only in the individual caregiver, but in the humanity and quality of care within the healthcare system as a whole. And exploring the methodologies of trauma-informed pedagogy can help us to address these crucial but difficult issues in a way that is sensitive to the lived experience of our students.